All right, this is the first lecture. Before I begin, I'll just say thank you to Dr. Nellie Oakley, who I've adapted these slides from and made a few of my own changes, but she did create the skeleton for this course and had a big influence on a lot of the content. So just to acknowledge that. So before we begin today, I will be talking about some definitions of policy, how we define policy, some main ideas around policy, but I'll just ask you to stop the video just really briefly and just write down on your own 3 to 5 sentences what you think policy is, what do you think it encompasses, a broad definition of your own, just to start to stimulate your own thinking. So you pause it here and give that a shot. So the main definition we're working with in policy for this course is policy is the choices that a society, segment of society, organization makes regarding its goals and priorities and the ways it allocates its resources to attain these goals. Policy reflects these values, beliefs, and attitudes of those designing the policy. And a few key points that I'll highlight there are pieces of values, beliefs, and attitudes. So when we're working with policy and practice, it's easy to forget that people make these policies. People are behind the policies. So where our own values, our own beliefs come through, they do impact policy and policymakers. So one of the first key steps when we're working with policy is to understand our own values and beliefs. So I'll leave that with you to think about a little bit as you're walking through this course. And interacting with some of these different ideas, maybe new ideas, maybe ideas you've thought about before, maybe you have a stance on. But a key thread I want to hold throughout the course is this idea of understanding the impact of values on policy. And you'll notice also in this definition that policy isn't only allowed to be, these smaller policies, local policies, or larger policies, more formalized legislation, that sort of thing. Policy is very, very broad. It's a very wide idea. So one other piece I'll hope that you take away from this course is how impactful and how the breadth of how policy impacts our work in healthcare. So public policy specifically is a course of action or inaction chosen by public authorities to address a given problem or interrelated set of problems. So often policy is aimed around an issue. Sometimes policy can be aimed at, the betterment of society, but often where we're starting within a policy is that there's some sort of issue that needs to be addressed. And then specifically from the public perspective, public policy addresses issues that the public is concerned with. There's a couple ways to break down policy. So one way that people split these up is thinking about big P policy. So defines course of action, generally occurs at these higher governmental levels. Legislation is an example of big P policy. So this is more formalized, generally covers maybe broader geographic or larger organizational levels. So for instance, the Canada Health Act, that's a backbone of the Canadian healthcare system. That's an example of definitely a big P policy, or something like the legalization of cannabis that happened in the last few years. These are big P policies that have widespread effects. Since we're in Canada, we're talking like a Canadian-wide, potentially provincial-wide, and they're often more formalized than maybe small P policies, which we'll talk about here. So smaller P policies is more the standards, directions that are developed locally. And this isn't a better or worse, less or more important, but tend to be a bit more locally impactful, more focused on specific organizations or specific groups. So workplace policies, municipal government policies, they might be less enforceable. So things like legislation are enforceable in the court of law, whereas small P policy might be more norms, standards, quality improvement, those sorts of pieces. So the examples I have here say interior health is a surgical safety checklist. That's a policy that people ought to follow, but that's not formalized into law, but that doesn't make it not policy. Or to give you an idea of the breadth, a policy on fragrance use in the School of Nursing, right? That's a policy, but it's much more localized, much smaller, aimed at a specific group of people. So if you can kind of think of those two different sort of buckets of policy, obviously there's lots in between, but to give you an idea of the breadth and scope of what we mean when we're talking about policy. Health policy is more specific, refers to decisions or plans and actions that are undertaken to achieve specific healthcare goals in a society. Or we might expand that to not just say healthcare, but health goals, right? So we'll talk about that a little bit more as we go through the course too. An explicit health policy can achieve several things. It defines a vision for the future, which in turn can help establish targets and points of reference for short and medium term, might outline priorities, expected roles of different groups, and often is used to help build consensus and then inform people of these different priorities. That's from the WHO definition of what constitutes health policy. And as we said before, in that big P policy bucket is health legislation. So these are the kinds of directives, documents that are determined by the government or potentially an arm's length government organization, such as the Public Health Agency of Canada, that may or may not become law. So when we're talking about legislation, we're talking about law. It includes ordinances, regulations, addresses many aspects of health protection, promotion, disease prevention, delivery of healthcare, and then can be formalized into law. So an example that we, for most of us probably are nurses or have some sort of nursing background, the Health Professions Act determines our scope of practice. So what we're legally allowed to do within our scope of practice for, say, an RN or NP. So just briefly, just to give a few more examples of, again, I'm trying to give lots of examples in this course of the range of how we interact with policy as nurses, as healthcare leaders. So I'm just going to flip over to the BC CNM has a document that talks about all the different ways that nurses are impacted by legislation that's relevant to their practice, whether directly or indirectly. So I won't go, obviously not going to go through the whole document, but just super briefly, we can see here, they have a list of the legislation that they think is relevant to nursing practice. So we have things like the Continuing Care Act, obviously Criminal Code, e-health, Food and Drugs Act, Health Professions Act, which we discussed, Mental Health Act. So these are many of these things you might be familiar with, depending on where you practice. You might say, for instance, if you work in Emerge and you need to be familiar with the Mental Health Act to know, for instance, for keeping people if you're worried about safety, right? So if someone's at risk of harm to themselves or others, involuntary admissions, that's an essential part of the Mental Health Act, right? So obviously a lot of these aren't specifically aimed at nurses or even necessarily at healthcare, but they impact health and healthcare and what we're allowed to do and what we're not allowed to do. And these would all be under the umbrella of policy that impacts healthcare. So I won't go through any of these specifically, but if you are curious, then there's the link there that you could go through and click through a few of those. Going through the list, there's definitely lots that I have never even heard of, right? So, there's a lot of, the breadth of policy. You can really see that in this document. So just defining the health system. So this is a health system delivers quality services to all people when and where they need them, or that's the goal anyways. Obviously, there's a variation of how well that goal is achieved. Significant variation from country to country, mixes of private, public, and everything in between. Requires robust financing. In Canada, the financing is done through federal provincial transfers. And obviously we require the well-trained and appropriate, adequately paid workforce. It's a highly, highly skilled workforce that takes a lot of years of training. So that's something to keep in mind. Reliable information for decisions and policies. So when we're dealing with people's health, we need transparency and reliability and evidence to make these decisions. Although, again, there's variation in terms of how much evidence is actually incorporated into decision making at some points in policy. especially depending on where you are. Appropriate facilities and medicines and technology to deliver care. So again, the complexity of healthcare is shown when we need, it's, you know, we can't just do this in any building. We need often expensive medicines, expensive machines, expensive technology. So you can really see that this requires a lot of financing, and it's an extremely complex system. So additionally, so the WHO states that health systems, these are some things that the WHO thinks that we should be focusing on. So ongoing improvement to strengthen the system resilience, especially to crises, as we've seen in the last few years, health security, and then universal health coverage. So obviously, you know, Canada does have some aspects that we do very well in terms of universal health coverage, but there's also a long ways we could do better, right? So some of those pre-readings you might have seen talking about some more hopeful, maybe aspirational ideas around what it would mean to actually have universal health coverage here. But again, if we're talking more in the geopolitical landscape, Canada does have more universal health coverage than many countries. Talking about who are the policymakers. So initially you might think, oh, policymakers are only the people that, you know, sit in parliament or in government, but as we've discussed, where the breadth of health policy or policies that impact health could be everything from, you know, a unit specific policy on some sort of procedure, all the way to something like the Health Professions Act that is in law, right? So obviously government at various levels make policy, from municipal to regional government, or provincial, federal. We also have health administrators, so people working in the different health authorities or maybe the Ministry of Health. We have regulators, so things like BCCNM, or maybe unions. Unions have policies. And then but maybe you. So maybe you've had some previous experience either working in policy, or you have ideas how you would like to see policy develop. So just to, again, this course is a taster course. It's a week long, is pretty short, and it's an intensive, and we cover a lot, but it's just to get really the thoughts stimulating of where you could see yourself potentially interacting with or influencing policy, and to realize that, you know, as for the most part, nurses or health professionals, you have the skills and knowledge necessary to interact with policy and to influence policy. So in Canada, policy is really concerned with healthcare delivery, really is more provincial and regional, because as we said, the federal government does the federal transfers, but really leaves it up to the provinces and then even smaller regions to actually figure out how they're going to deliver healthcare to their populations in a way that aligns with the Canada Health Act. Some things to think about when you're talking about policymakers is thinking about who they're making policy for. So for instance, most of us probably be familiar, the BCCNM is more focused on protecting the public, protecting patients, whereas BCNU is more focused on protecting the workers, right? So who are those policies actually aimed at either protecting the interests of, or potential adversarial groups, right? So who is this policy being made for? Whose interests are served by the policy? And then another thing that I hope you'll be taking away throughout this lecture is thinking about how enforceable policy is, right? So thinking about, you know, again, hopefully it's not too silly of an example, but the fragrance policy versus a policy that is legalized, that is in the law, right? So if you break the law, you can go to jail, whereas maybe some local or smaller level policies, it's more has professional consequences. But thinking about who is the policy for, who enforces it, and how enforceable is it, are a few things you can think about when you're reading different policies or thinking about where policies come from. Politics. So politics obviously have massive influences on policy, who's in power, who's in government. That has major influences on policy direction and strategic direction. So a brief definition of politics is actions and activities that are used to achieve and use power in a country or society. And that's just from like a general dictionary definition. Tactical activities or strategies a person takes to influence the decisions or actions of others. Competing interests and goals, jockeying for a favorable position or approval. Often politics are conceived to be negative, but I think they're more just reality. So something to, rather than ignore, to engage with and to understand that often health policy is political. And again, going back to that around your values, your judgments, and your ethics, and to rather than be blind to those things, but to rather explore them within ourselves and understand how they're influencing maybe different decisions or the decisions of people who are making policies, and understand where those values and politics are influencing the policies that are made. So yeah, we'll leave that there. So this is just like a few dimensions of politics, and public life. So the way people conduct and manage community affairs, put politics in conflict resolution, so compromise, conciliation, negotiation, politics and power, so desired outcomes that are achieved through production, distribution, and use of scarce resources. So again, just to understand that politics are inevitable, right? So, but we need to understand how they're influencing different decisions that people are making. And power is closely related to the concept of politics, and both are associated with the overall concept of influence. Often negatively associated with social inequality or dominating others, positively associated with effectiveness, ability to mobilize resources, potential to create change. So I think this person can say it better than I can. We're going to just watch a brief video discussing power. So hopefully you'll stay with me here as we watch this together.
Of your life, you move through systems of power that other people made. You sense them? Do you understand power? Do you realize why it matters? Power is something we're often uncomfortable talking about. That's especially true in civic life, how we live together in community. In a democracy, power is supposed to reside with the people, period. Any further talk about power and who really has it seems a little dirty, maybe even evil. But power is no more inherently good or evil than fire or physics. It just is. It governs how any form of government works. It determines who gets to determine the rules of the game. So learning how power operates is key to being effective, being taken seriously, and not being taken advantage of. In this lesson, we'll look at where power comes from, how it's exercised, and what you can do to become more powerful in public life. Let's start with a basic definition. Power is the ability to make others do what you would have them do. Of course, this plays out in all arenas of life, from family to the workplace to our relationships. Our focus is on the civic arena, where power means getting a community to make the choices and to take the actions that you want. There are 6 main sources of civic power. First, there's physical force and a capacity for violence. Control of the means of force, whether in the police or a militia, is power at its most primal. A second core source of power is wealth. Money creates the ability to buy results and to buy almost any other kind of power. The third form of power is state action, government. This is the use of law and bureaucracy to compel people to do or not do certain things. In a democracy, for example, we the people theoretically give government its power through elections. In a dictatorship, state power emerges from the threat of force, not the consent of the governed. The fourth type of power is social norms, or what other people think is okay. Norms don't have the centralized machinery of government. They operate in a softer way, peer-to-peer. They can certainly make people change behavior and even change laws. Think about how norms around marriage equality today are evolving. The fifth form of power is ideas. An idea, individual liberty, say, or racial equality, can generate boundless amounts of power if it motivates enough people to change their thinking and actions. And so the sixth source of power is numbers, lots of humans. Vocal mass of people creates power by expressing collective intensity of interest and by asserting legitimacy. Think of the Arab Spring or the rise of the Tea Party. Crowds count. These are the 6 main sources of power, what power is. So now let's think about how power operates. There are 3 laws of power worth examining. Law number one, power is never static. It's always either accumulating or decaying in the civic arena. So if you aren't taking action, you're being acted upon. Law number two, power is like water. It flows like a current through everyday life. Politics is the work of harnessing that flow in a direction you prefer. Policymaking is an effort to freeze and perpetuate a particular flow of power. Policy is power frozen. Law number three, power compounds. Power begets more power, and so does powerlessness. The only thing that keeps law number three from leading to a situation where only one person has all the power is how we apply laws 1 and 2. What rules do we set up so that a few people don't accumulate too much power and so they can't enshrine their privilege in policy? That's the question of democracy. And you can see each of these laws at work in any news story. Low-wage workers organize to get higher pay. Oil companies push to get a big pipeline approved. Gay and lesbian couples seek the legal right to marry. Urban parents demand school vouchers. You may support these efforts or not. Whether you get what you want depends on how adept you are with power. Which brings us finally to what you can do to become more powerful in public life. Here, it's useful to think in terms of literacy. Your challenge is to learn how to read power and write power. To read power means to pay attention to as many texts of power as you can. I don't mean books only. I mean seeing society as a set of texts. Don't like how things are in your campus or city or country? Map out who has what kind of power, arrayed in what systems. Understand why it turned out this way, who's made it so, and who wants to keep it so. Study the strategies others in such situations used. Frontal attack or indirection. Coalitions or charismatic authority. Read so you may write. To write power requires first that you believe you have the right to write, to be an author of change. You do. As with any kind of writing, you learn to express yourself, speak up in a voice that's authentic, organize your ideas, then organize other people, practice consensus building, practice conflict. As with writing, it's all about practice. Every day you have a chance to practice in your neighborhood and beyond. Set objectives, then bigger ones. Watch the patterns and see what works. Adapt, repeat. This is citizenship. In this short lesson, we've explored where civic power comes from, how it works, and what you can do to exercise it. One big question remaining is the why of power. Do you want power to benefit everyone or only you? Are your purposes pro-social or anti-social? This question isn't about strategy. It's about character. And that's another set of lessons. Remember this. Power plus character equals a great citizen. You have the power to be one.
All right, so hopefully everyone enjoyed that. I watched it multiple times. I still like it. One thing I'll notice, or I hope that you'll notice too, is by. Oops.
I bring you greetings from the fifth.
Oops, sorry about that. One thing I hope you'll think about too is by the different types of power. So for instance, by being in a master's program, which you all are, is a form of power. So education is a form of power. Even, when we talked about being in nursing school, having the power dynamic with your patients, right? So examining your own levels of power and realizing that you do have the ability to influence policy, just at the position that you're in, is quite a powerful idea. So I hope that throughout just this short intro piece that you've realized that the scope of health policy is very, very broad, that it covers healthcare, other health-related policies. In Canada overall, health policy tends to be a little bit more siloed, but in the next couple slides, I'll show a couple ways where health policy really can interact with other types of more public policies. So in Europe, they focus more broadly on policies that impact health, so more social policies, environmental policies, So to talk about that, there's this framework called Health in All Policies that was first put forward, I think, in Finland in 2006 when the country was the president of the European Union. And it's the idea that health should be assessed in all policies that are put forward. So, for example, obviously a hot topic right now is climate change. And so to understand how different policies impact health and healthcare for all people. So it's a responsibility not just of the health sector to account for health and decisions, because obviously decisions that are made in other public areas have impacts and long-lasting impacts on health. So the CNA has actually a health impact assessment and the health equity impact assessment that they have as tools for people who are interacting with policy to better understand how they can do an assessment of that policy and how it impacts health. So the link's there if you want to check those out. The other thing I'll just mention is there's another framework called the One Health approach. So it's the idea that the health of people is closely linked to the health of animals and larger environments. So again, having that idea that policies that impact the environment, that impact the health and well-being of the natural environment also impact the health of humans. So common threats that are addressed in the One Health approach are antimicrobial resistance, which we've all, or probably most of us, have put on those contact gowns and know what the impact of antimicrobial resistant germs are. Vector-borne diseases in food and animals, and contamination of water. And again, a perfect example of this is the COVID-19 pandemic. So this is highly relevant and highly topical at the moment. So again, I'm not going to dig too much into this, but if it's something that you're interested in, I encourage you to check it out. And you can just Google One Health approach. There's lots of good resources on the CDC and I think some Canadian websites too. One more framework that I'll flag for you, and again, this is an area where you can do some of your own learning, is the Sustainable Development Goals. So these are 17 different goals that were created by the United Nations. They're interrelated, and as you'll see, they cover a wide variety of topics from climate action to responsible consumption and production. There is a specific good health and well-being, but this idea that they're all interrelated and that policy and actions taken in one of these domains will have ripple effects into other domains. So generally for most of us in this class, the main focus will be on good health and well-being, but just to understand that policies developed in other domains of public policy impact health policy and well-being, and that we as health policy or beginning experts do have the knowledge and ability to be vocal on policies that aren't just only specifically on health. So we'll do one more video. I'll remember to actually pause it this time.
Today, I'd like to talk to you about the woman in the picture behind me. Her name is Josefa, and she was born in Cuba several years before the Communist Revolution. The late 1970s, she would then decide to leave everything she knew behind, determined to give her family a chance at a better life in the US. She also happens to be my grandmother, and one of the most important figures in my life as I was growing up. Some of my happiest childhood memories were simply getting to come home every day from school to be given a huge, big hug from my grandmother. But that hug would one day turn my life upside down. You see, as my head brushed up against the side of hers, I felt a big lump. When I asked her what it was, she said it was nothing, but I would later go on to overhear my family talking about a tumor and cancer. I can't begin to describe to you what I felt in that moment. My grandmother was my whole world, and as I stood in that doorway listening, I was paralyzed with fear. I begged and pleaded with my grandmother that she go to the doctor, but the harsh reality was that my family simply couldn't afford it. And in my young mind, the concept of my grandmother's life hanging in the balance over a question of money didn't make any sense to me. It was perhaps the first time in my life I had ever felt powerless. Powerless over my circumstances, powerless at my inability to do anything for someone that meant so much. And I remember desperately wanting a way out. Sometime later, that way out would come, thanks to the chance generosity of a family friend to whom I'll forever be thankful for what he did for my grandmother. But are we comfortable with that? With the notion that a person's life potentially hinges on the means they have? That wealth so directly determines something as basic and fundamental as health? At the time, I never questioned that reality. As a kid, I simply internalized my experience and became intensely focused on the only thing I felt I had any control over: my education. It wasn't until many years later, upon arriving at Stanford and taking a health policy course, that I would come to feel empowered to revisit and question that reality. For 10 weeks, I sat in class horrified and fascinated by what I learned. Horrified by the scale upon which I saw my own family's health struggles writ large across our nation, but fascinated by the potential of policy to have such far-reaching positive effects on the lives of so many people. I began to wonder if the current state of healthcare was truly inevitable, or if a different reality was possible. And my search for an answer to this question would lead me to work over the last 4 years in 5 countries spanning Europe, Asia, and Africa. And today, I'd like to take you on that journey to 3 of those places. First on my list was France, which I had learned had been ranked as having the best healthcare system in the world by the World Health Organization in 2000. And what struck me the most working in a Parisian hospital was not only how accessible healthcare was for everyone, but how universally agreed upon it was among the French that it should be. This is something that I would later go on to note about the Japanese healthcare system while I was living and working in Japan for 1 year. Here was a country with some of the world's best health outcomes, longest life expectancy, one of the lowest rates of infant mortality, had managed to achieve universal coverage at a time when Japan was still rebuilding itself after World War II, and yet manages to spend half what the United States spends on health per capita. As I reflect on these experiences with you, I don't mean to oversimplify the issue or lead you to believe that I think that what has worked in one country is directly adaptable or transferable to another. The more countries and systems I've had the opportunity to study, the more I've come to appreciate just how truly complex the issue of healthcare is. But I've also come to believe that what's possible in terms of healthcare access is largely dependent on what societies choose to value and make possible for their populations. The best example I can think of this is Rwanda, where I recently worked with the Clinton Health Access Initiative, a country ravaged by genocide less than 20 years ago. 10% of its population murdered, with more than half of its population still living in poverty. The house I lived in didn't have running water or direct access to paved roads. I was fortunate to have electricity, the only house in the district to have it. And yet, even in the absence of so many resources and basic necessities, they felt it was so indispensable that everyone should have a basic minimum level of healthcare that they chose to make it possible. Now, I'm not saying that I think the Rwandan healthcare system is perfect. Much work still remains to be done. But considering that they have an annual health budget of $56 per person, I'd say they're doing pretty well. And the world is taking notice. Something that seemed so impossible just a few years ago, the notion that developing nations could achieve universal coverage, is now not only increasingly being regarded as feasible, but as the next step in continuing to make sustainable global health progress. That perhaps has been the biggest take-home lesson for me. Where there's a will, there's a way. In the US, this doesn't seem to be a question of resources. According to the World Health Organization's 2010 World Health Report, the United States spends over $2 trillion a year on healthcare out of a global $5.3 trillion. That's approximately 40% of all the money that is spent all over the world on health in one country, in our country. And yet somehow 50 million Americans slip through the cracks, remaining uninsured. In the words of one of my Rwandan colleagues, he said, "Raiden, if your country can't do it, then who can?" And when I think about this issue from that perspective, the question I find myself asking is not whether we can afford to ensure a basic minimum level of healthcare for everyone, but whether we choose to make that possible. Last year, a man in North Carolina robbed a bank, demanding $1, hoping to be sent to prison so that he could receive medical attention for a growth in his chest he couldn't afford to treat on his own. How desperate does a human being need to be, need to feel, to be willing to trade his freedom for his health? I came to share my story with you today because despite how divisive the issue of healthcare in our country has become, I believe that we profoundly want and can aspire to more than the status quo. That a world where a poverty of wealth does not necessitate a poverty of health is possible. A world where people like my grandmother do not need to forego potentially life-saving treatment because of a lack of resources. But this doesn't become possible because a few policymakers, doctors, health economists, advocates get together to engineer a perfect solution. Truly sustainable changes, I believe, are first dependent on what we all as a society choose to value and believe to be possible. What do we value? What do we choose? Thank you.
So I hope maybe something you took away from that again is talking about values and policy and the desire and the need actually to examine values when we're making policy. A few pieces also that we'll be talking about throughout this week is around the issue of universal healthcare. So one of our guest lecturers, Dr. Mike Law, will talk about universal drug coverage, which is something that we're still quite a long ways from. Recently we had some dental benefits become law. So I think children under 12 having access to dentistry if they need it. But even though Canada is has much more universal healthcare than somewhere like the United States, as he was talking about, we're still a long way from true universal health coverage. So something to think about. So just to wrap up almost here. So thinking about policy levels, so micro, something that's unit specific, hospital specific, meso, health authority, potentially more regional, and then macro federal and provincial mandates. So there are many ways to influence policy and many impactful ways that policy can impact the health and well-being of people at all of these levels. And not to say that micro level policy can't be extremely impactful as federal or provincial mandates. But I hope this first lecture is kind of giving you an idea of some definitions and an idea of where we'll be heading throughout the course. And I think that's it. So if you have any questions about any of that, then please bring them to the synchronous session in the afternoon, where we're going to be chatting again as a group. And we'll see you in the afternoon. Thank you so much.